Posluma. On May 25, 2023, FDA approves Posluma to use with positron emission tomography imaging in certain patients with prostate cancer. Posluma is a radioactive diagnostic agent indicated for positron emission tomography, PET, of prostate-specific membrane antigen, PSMA, positive lesions in men with prostate cancer with suspected metastasis who are candidates for initial definitive therapy. With suspected recurrence based on elevated serum prostate-specific antigen, PSA, level. Dosage and administration. Radiation safety, drug handling. Handle Posluma with safety measures to minimize radiation exposure. Use waterproof gloves, effective radiation shielding, including syringe shields, and other appropriate safety measures when handling and administering Posluma. Radiopharmaceuticals should be used by or under the control of physicians who are qualified by specific training and experience in the safe use and handling of radionuclides, and whose experience and training have been approved by the appropriate governmental agency authorized to license the use of radionuclides. Recommended dose and administration instructions. The recommended amount of radioactivity to be administered in adults is 296 megabecquerels, 8 mc, as an intravenous bolus injection. Preparation and administration instructions. Inspect Posluma visually for particulate matter and discoloration before administration. Do not use the drug if the solution contains particulate matter or is discolored. Use aseptic technique and radiation shielding when withdrawing and administering Posluma. Calculate the necessary volume to administer based on calibration time and required dose. The recommended maximum volume of undiluted Posluma is 5 milliliters. Posluma may be diluted with 0.9% sodium chloride injection, USP. Assay the dose in a dose calibrator before administration. Post-administration instructions. After the Posluma injection, administer an intravenous flush of sterile 0.9% sodium chloride injection, USP, to ensure full delivery of the dose. Dispose of any unused drug in a safe manner in compliance with applicable regulations. Dosage forms and strengths. Injection, 296 megabecquerels per milliliter to 5,846 megabecquerels per milliliter, 8 mc per milliliter to 158 mc per milliliter, as flotufolastat F18 gallium, and approximately 25 milliliters at end of synthesis, supplied as a clear, colorless solution in a multiple dose vial. Adverse reactions. Clinical trials experience. Because clinical trials are conducted under widely varying conditions, adverse reaction rates observed in the clinical trials of a drug cannot be directly compared to rates in the clinical trials of another drug and may not reflect the rates observed in practice. The safety of Posluma was evaluated in 747 patients with prostate cancer. All patients received a single administration of Posluma with an administered radioactivity, mean plus or minus SD, of 307 plus or minus 23 megabecquerels, 8.3 plus or minus 0.6 mc. The mean age of patients was 67 years, range 43 to 86 years. Distribution by race was 78% white, 12% black or African American, 2% other, and 7% unreported, and distribution by ethnicity was 5% Hispanic/Latino, 87% non-Hispanic/Latino, and 8% unreported. Drug interactions. Androgen deprivation therapy, ADT, and other therapies targeting the androgen pathway, such as androgen receptor antagonists, can result in changes in uptake of flotufolastat F18 in prostate cancer. The effect of these therapies on performance of Posluma PET has not been established. Mechanism of action. Flotufolastat F18 binds to PSMA, IC50 equals 4.4 nm, expressed on cells, including prostate cancer cells, and is internalized. Prostate cancer cells usually overexpress PSMA. Fluorine 18 is a sharp S+ emitting radionuclide that can be detected using positron emission tomography. Pharmacokinetics. Distribution following intravenous administration. Flotufolastat F18 distributes to liver, 15.8% of administered activity, heart blood pool, 7.4%, and kidneys, 3.2%, and is cleared from the blood. Metabolism. Flotufolastat F18 does not undergo metabolism up to 50 minutes post-injection. Excretion. Elimination is by urinary excretion. Approximately 7% of the administered activity was excreted in the urine in the first 2 hours post-injection, with approximately 15% excreted by 4.5 hours post-injection. Carcinogenesis, mutagenesis, impairment of fertility. Animal studies to assess the carcinogenicity or mutagenic potential of flotufolastat have not been conducted. However, flotufolastat F18 has the potential to be mutagenic because of the F18 radionuclide. No studies in animals have been performed to evaluate potential impairment of fertility in males or females. Imaging prior to initial definitive therapy of prostate cancer. The safety and efficacy of Posluma were evaluated in Lighthouse, NCT 04186819, a prospective, multicenter, open-label, single-arm study in patients with prostate cancer who were candidates for initial definitive therapy. The study enrolled 356 patients diagnosed with unfavorable intermediate risk, 32%, or high/very high-risk prostate cancer, 68%, who were candidates for radical prostatectomy and pelvic lymph node dissection, PLND. Unfavorable intermediate risk was defined as having any greater than or equal to 2 intermediate risk factors, T2B T2C, Gleason score 7, PSA 1020, Gleason pattern 4 plus 3 equals 7, or greater than or equal to 50% of biopsy cores positive for prostate cancer. High or very high risk was defined as having T3 or T4 disease, Gleason score greater than or equal to 8, primary Gleason pattern 5, and or PSA greater than 20. How supplied/storage and handling. How supplied? Posluma injection is supplied as a clear, colorless solution in a multiple dose glass vial, NDC 69932 containing 296 megabecquerels per milliliter to 5846 megabecquerels per milliliter, 8 mc per milliliter to 158 mc per milliliter, as flotufolastat F18 gallium and approximately 25 milliliters at end of synthesis. Storage and handling. Store Posluma at 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit CUSP controlled room temperature. Store Posluma in the original container and radiation shielding. The expiration date and time are provided on the container label. Use Posluma within 10 hours from end of synthesis. Dispose of unused Posluma in compliance with applicable regulations. This preparation is approved for use by persons under license by the Nuclear Regulatory Commission or the relevant regulatory authority of an agreement state.